Okay, so our next level of how we are going to approach a patient, once we evaluate the patient on a skin level, then we start asking most patients come saying, I want a filler, I want Botox. And so we are all about doing that instant gratification because everybody wants instant gratification, and fillers and Botox, Dysport, Nutox, it does give you that instant gratification. And so we do look at how we can use these injectables to really enhance the face. And you have to understand that you're having a plastic surgeon, a facelift surgeon who is injecting your face, which is very unique. Actually, there are not many plastic surgeons who actually like to inject. Dean, on the other hand, really loves injecting. He loves injecting as much as he loves his facelift surgeries. So you have to understand, you've gotten a physician who understands the anatomy of the face, the expressions of the face, and how the injectables will work in your expression. And that's pretty unique. He just doesn't know, like, here's an area and here's an area, where a lot of doctors will do, oh yeah, we'll do this area and that area. That is just not how we do it, because he wants you to express. He wants you to move your muscles. He wants you to smile. We want to see, does your lips get thin as you smile? How thick are the muscles in your glabella? Are you really developing these thick muscles? Are you really getting just a crow's feet? Do you need the elevation? So we both are looking at your face with understanding your expression and how we can work with your expression and how we can best use fillers. And he really gives you the liquid facelift. So patients will have, it seems like a lot, like 3 or 4 fillers at a time, plus, our Dysport or the Nutox, but you come out with a pure changed face instantly. And it's the perfect transition for women who just aren't really ready for that, aren't needing a facelift, wanting a facelift,
or maintaining a facelift.
Yeah, and so from an injectable point of view, and we use the Restylane fillers of family, or the family of Restylane fillers, and we have the whole range of from really thin ones to really full ones, for fine lines to really volumize. And so we really strategize what filler for what problem. And again, it's just not one filler for one problem. We really have the whole array to decide which filler is going to be best for that patient. We just had an example just the other day where the woman's lips are so thin and she's so afraid to have a filler. She was really petrified. I said, please, believe me, we're going to give you the thinnest filler just so that we could get rid of your lip lines.
And smooth the lips from any wrinkles.
And she was as nervous as could be, and I said, please trust me. We really try to do the right thing for you. And she was exhilarated. She like, oh my God, my lips aren't huge, they're not big, they're just right. And for her, it was perfect.
Because we have so many options, sometimes a little bit is better than too much. So sometimes it's better that a little less is greater than more. So what we'll do is maybe reduce the wrinkle lines by just a little Dysport, and then come back and fill the lines with a very smoothening, buttery type filler. That's not available to everybody, but because we use so much filler in our practice, and because of the creative needs to be able to improve a fold versus a crease line, very different aspects of skin laxity and aging, because of our ability to be able to do lifting or contracting, tightening, firming, we have all of this at hand, and it's non-surgical.
So, you want to stay tuned to the next part? Because we're going to talk about thread lifts. So that's our next level.
Thread lifts.